Hey, it's Dr. Brandon Pettke. Today we are going to discuss migraines. Specifically, I want to talk about an underlying cause that I see very often get overlooked. I see patients that have suffered with migraines for years and years and years. They've taken medication after medication, gone from doctor to doctor, and they still suffer with these migraines. And what happens is a lot of times there's a underlying issue that's going on. They work their way to our office and we find it, and literally I would say probably about 90% of my patients that have migraines, I end up finding this on their x-ray. So I want to show you some normal x-rays first and foremost, and then I want to show you what I found and then why that happens and why they get the symptoms of the migraines in these cases. So if you want to come on up here, we're going to take a look at the normal x-ray. And so this is a normal x-ray of the neck looking at the person from the side. So they're facing that direction, and I'm just going to go over a couple different things. So there's 7 bones in the neck, and so what happens is when we look at the neck from the side, number one, there should be a nice smooth curve in the neck. Okay, that's number one. The second thing, if you can see on here, is the very top bone is called C1. This is 1, 2, 3, 4, 5, 6, 7. And if I go to the middle of C1 right there and I drop a gravity line, it should be right through C7. So they should be right on top of each other. So their center of gravity should be right on top. All right, so now what we're going to do, I'm going to turn this off so it's a little bit easier on the camera. We're going to come down here. This is a recent patient. If you'll come in and zoom in on this so you can see. Now, remember I talked about the curve being normal. You can obviously see this person is facing the exact same direction, that direction. And you can see instead of having a curve like this, they actually have a reversal of the curve. Okay, they got a reversal of the curve, and then that very top vertebrae, like I talked about right there, this is 2, 3, 4, 5, 6, 7. So look, if I drop that same gravity line, look how far out in front it is. It's like 2 inches out in front. Okay, so they get a reversal of the curve, and their head forward is way out in front. So now, what I'm going to describe what's going on and why do they get the symptoms of the migraines. So inside, I'm going to use the webbing of my hand. Okay, so inside that normal curve of the neck, or maybe I should use this way since I showed you that way. So inside the normal curve of the neck, where the brain sits up here, the spinal cord comes out, it goes right down. In fact, if you want to come back in here, I'll show you. See this line right here? Okay, and then you kind of see these lines right here. That's the spinal canal. That's where the spinal cord goes, okay? So that's what it looks like. It goes here, and then it goes right there. Now, if we come back up here to this one, I'm going to show you the same thing. See this line right here? Hopefully it comes in on the video. And then you see this line right here. So the brain sits up here, and the spinal cord goes right down there, okay? So that's important to what I'm about to explain to you. So if this is the curve, okay, just like the webbing of my hand, that nervous tissue, the neurons, the spinal cord, they should sit in there, and they should sit in there nice and lax, okay? Well, when I take that curve and I reverse it like this, what happens to that webbing of that hand? Obviously, it gets much more tight. It has a lot more strain on it. Worse, everybody's heard of nerves being pinched before. Worse than nerves hate to be pinched, they hate to be stretched. All right, and so any neurological structure does not like to be stretched. Even when we have like low back pain and sciatica, a classic test is we raise up the leg when somebody's laying on their back and we stretch out that nerve, and if it recreates the pain, we know that there's an issue in the disc in the low back. It's the exact same similar process in the neck. When somebody's curve looks like that second one that I showed you, when it's reversed like there is constant neurological stress on those tissues. And I don't care how many pills somebody takes, right? You can answer this. Look at this one right here. How many pills could somebody take to correct that? How many injections could they get to correct that? Like, it's just not going to happen. You have to use a different set of tools for these individuals to get that corrected. And that's exactly what we do here in the clinic. We use a combination of modern, gentle chiropractic. If you've never been to a chiropractor before, that's a lot of our patients, so we can explain everything to you. But we do modern chiropractic, and we combine that with physical therapy as well. So we got a whole variety of different treatments that we can do on the physical therapy. And what we can do, and there's even some things that the patients do at home on their own to help correct that. But what we do is we basically start the process of bringing that curve back into its more normal position and bringing that head from being out forward like this to bringing it back into a more upright position. When we do that, we take that stress off of those neurological structures, and guess what happens to their migraines? They go away, or they vastly improve. So that's how we're able to help migraines, even after people have been suffering with migraines for years and years and years. And so if you or yourself know someone that has been suffering with migraines, I'm gonna encourage you to reach out to our office, call our office, get set up for an appointment. Let's evaluate you. Let's look and see if this is something that you're experiencing. Let's see if we can help you as well. So anyway, hopefully this information has been useful, and I hope you have a wonderful day. Take care.